Hey everyone, happy Friday. It's Danielle here from the Fertile Spirit, which is CNY's patient support program. And I am really, really excited to be joined today by Renae Giacopuzzi. Is that how you say your last name?
Yeah.
I'm a fellow Italian, I should be able to say it. But I wanted to, have Renae on here because in addition to being a yoga teacher, she runs a pelvic floor therapy clinic, or I guess it's a PT clinic that specializes in pelvic floor therapy in California. She has a lot of experience and thoughts about advocating for yourself in this kind of world of health, and also about her own experience through endometriosis and the benefits of pelvic floor therapy for different kinds of issues that women face, both in terms of getting pregnant and working with fertility, and then through pregnancy and into postpartum. So I will let you are the expert on these things. So I just felt like Renae had a lot to share with everybody and really good information. So we're here today to do that. So hi, Renae.
Hi, thanks so much for having me on. I'm really excited to, communicate with more people. I do have a lot of little things that I love talking about and am interested in. And really that all comes back to wanting people to learn how to advocate for themselves and being able to do that well. And that comes from my personal experience and my professional experience. And like Danielle mentioned, I have endometriosis, and like many people, it took a really long time to diagnose. And there were Band-Aid fixes, and there was a lot of confusion. And it ultimately came down to the fact that my sister is actually a doctor and, of course, knows me like the back of her hand, and was able to help me get that diagnosis. And kind of through that process, I realized, as someone who works, I manage a medical clinic, and I come from a medical family, and I have people in my family who are in the medical fields. And if I wasn't comfortable figuring out how to navigate that, then probably most people weren't. And so I kind of went through this long journey of figuring out how to communicate with my doctors, that led me to realize that this is something that other people need to know how to do as well. And through that, it kind of led me to pelvic floor physical therapy. And I've been managing the PT practice I'm at for 3 years now. And we actually didn't have any pelvic floor physical therapists in our area. And I found a really great one, and she had a beautiful baby and wasn't able to come back to working. And so I, with the help of my boss, we hunted down a pelvic floor physical therapist who's incredible, because there is such a need. And it's something I'm really passionate about.
Yeah. And for people who are watching who are in California, because we have people kind of all over, what is the name of the clinic that you run?
It's Village Fitness and Physical Therapy, and we are in Glendora.
Okay, California. Great. Could you talk a little bit more about what your kind of experience was with endometriosis and all the different things that you encountered, and how you kind of came to this?
Yeah, absolutely. So I think, like many young girls through high school, I had really hard periods, and very young was put on hormonal birth control to help control that. And that worked, and it was helpful for a while, but I started having some really negative side effects to that when I was about 22, and immediately came off of it, and side effects went away, which was great. And then immediately had to start missing work because of the ovulation pain and the period pain, which was just adding up, and it was making my life very hard. And I went to my doctor, and they were like, no, this is normal. Like, if you're not open to hormonal birth control, which I was really scared of at that point, because of my experience with it, there's nothing we can do for you. And then I talked to my sister, and I communicated, and she was like, well, this kind of sounds like endometriosis. And so I went back to my doctor with a plan of how to communicate the most specific symptoms, and how to really get the information across. Because what I realized is my sister is very smart, but most doctors are very smart. And so it wasn't a lack of knowledge on their part by any means. It was a lack of knowledge of my history, and the fact that I didn't know how to communicate the key important factors to them. So with the help of people in my life, I was able to put together kind of a plan of like, these are the things that set my pain apart from general pain with my cycle and really get their attention and be able to communicate very clearly with them. So through that, I was able to go in and eventually get a diagnosis and find something that worked for me. And then eventually ended up in pelvic floor physical therapy, which, we can go into now or later, but that is kind of the big picture of how I got diagnosed.
So would you be willing to share some of what you experienced in terms of like the symptoms with birth control? And then also like some of the symptoms that you kind of had to expressly share with the doctor to kind of get that endometriosis diagnosis. And by the way, for people watching, and Renae, I'm sure you can say more about this, but endometriosis and PCOS, polycystic ovarian syndrome, are some of the leading causes of challenges with fertility, with getting pregnant. So it's a huge issue in this community, and one that doesn't really get as much attention as it probably should, given how prevalent it is. So yeah, maybe some of those warning signs or symptoms would be helpful.
Yeah, absolutely. So while I was on birth control, I actually started to have partial seizures. And so that was my big thing that I realized was happening. And there was really no other thing going on in my life that could have been a cause of it. And so they were able to pick up very quickly, like, okay, this is the only medication you're on. This is probably it. And it ended up being that. So that was my symptoms with the birth control. And that was the pill. And there are tons of other forms of birth control that work better for different people. And so that was just my experience with it. And then for endometriosis, the key things were the type of cramping that was happening. The ovulation pain was a key thing as well. Trying to explain that I was missing work for that and explaining exactly how much it was impacting me. But the real key thing that set it apart was the fact that I was having really painful rectal cramping, which is very unique for just normal period pain, and usually means that there's some endometriomas elsewhere in the body than just the uterus. And so that was growing and expanding, and they were able to confirm that later as well. So really communicating like, I'm not just experiencing cramps, this is specifically where I'm hurting in my body, and being able to get as specific as possible about where you're feeling your pain and what type of pain it is. If it's just throbbing, if it's sharp, if it's consistent, and where in your cycle it is as well is really important.
Super helpful. Thank you for that. I hope everyone watching is taking notes because it's really important. And then in your story, did you end up having surgery for your endometriosis to remove it?
I opted not to, and that's personally because I'm not trying to have kids yet, and endometriosis does have the potential of growing back. And so I am not wanting to have kids yet, and so I'm waiting to have that surgery until it's impeding my ability to have kids, if that ends up happening. So that was kind of just a personal choice, and through having an IUD and pelvic floor physical therapy, I've been able to manage the pain pretty well. So at this point, it hasn't been necessary.
And can you say a little bit more about just the pelvic floor physical therapy, or any dietary things, or anything you've done to kind of improve the symptoms of the endometriosis?
Yeah, absolutely. So pelvic floor physical therapy was a huge thing for me because, like most people with a chronic disease, I felt insanely out of control. I felt like I had no control over my pain at all. And that was true because I didn't understand any of my pelvic floor muscles. And my physical therapy practice, we are partnered with a fitness studio. And so I have a lot of knowledge of, strengthening normal other parts of my body. And as a society, we talk a lot about like, okay, you're going to strengthen your arms or your core. But we don't talk about the pelvic floor as a muscle, which it is. And I learned a lot about how to control my pelvic floor, and with my cramping, what I could do to release that. And it just made it a lot more in my control for me. I had a lot of tools to use that helped me be able to manage that cramping and pain. And yeah, that's kind of the big picture. So pelvic floor, there was just a huge gap in knowledge for me. And I think there is for a lot of women. And I'm personally of the belief that every single woman should go have an eval with a pelvic floor physical therapist, because they'll probably learn something really cool, even if they're not having any issues. And personally, as a doula, I recommend all my clients see a pelvic floor physical therapist postpartum to learn how to heal those muscles, just as you would any other muscle that's had a trauma. So yeah, I have learned so much, and I feel like there is just so much to learn about that muscle because we don't really talk about it.
Right. And that's the thing. I mean, that's what I'm sitting here thinking. It's like there's such a stigma and almost a shame about talking about that part of our body. So like it ends up getting kind of repressed and not really being expressed and explored and cared for in the way that we would, like, you know, our legs or our whatever, our abs or something, because there is the stigma. And yet, like, it's such an integral, hugely essential part of our bodies that, you know, is active throughout, you know, our lives and through our cycles and everything. So it's great to just kind of name it.
Yeah. And what I realized is, like, you know, you sprain your ankle, you're going to go to a doctor and you're going to get follow-up care for that. And you're going to slowly heal those muscles. And we don't talk about birth in the same way. And we don't talk about healing the pelvic floor in the same way. And there's just so much care that can be done to prevent future problems and prevent future incontinence or issues. And I just talk to women all the time who don't even know that it's not normal, or that they have an option to start healing and just start training these muscles again, because they are there. They're just potentially inactive or overactive, or overstressed. So
I would imagine too that, like, there's, you know, the issue of painful periods. There's clearly the issue of if someone has probably any birth is going to be really intense for those pelvic floor muscles, but particularly a traumatic birth, if there's something like a tear. I would wonder too, like, for people who might have, you know, have difficulty or pain when they're having sex as well, like whether that's just something they've always experienced or something that they're experiencing after giving birth, that's another place where pelvic floor therapy would be really useful.
Absolutely. And actually, one of our physical therapists who specializes in pelvic floor, she actually got into pelvic floor physical therapy because she had pain in sex and was told, like, oh, you'll get used to it. You'll get used to it. And just didn't. And eventually started talking to people. And she was a physical therapist as well. And so she ended up going into pelvic floor because she was having pain with sex, and realized, again, there was that gap of knowledge of people just either not talking about it because they felt like it was shameful, or they couldn't have sex properly, or they just were told it was normal. So yeah, it's absolutely something that can be worked on. And every time I go to my pelvic floor physical therapist, it blows my mind, because I can say, for example, like, I have really bad tailbone pain on my period. And it's a more recent thing. And I told her, I was like, I'm having this really bad tailbone pain. And she was able to press on the muscle and say, do you feel it now? And I was like, yes. Why do I feel that in my tailbone? She's like, well, those muscles are connected. They're just, you know, you wouldn't expect it. And one of those random things that was just like a light bulb moment for me. And so there's more than you could even really imagine that you can get help for.
Yeah, I think, you know, as someone who works kind of holistically and works therapeutically, and, like, you know, I'm always like I would call it trauma informed, which, you know, some people might relate to or not relate to, because I believe we all have varying degrees of trauma, big T trauma and little T trauma, as they say. But that when I'm like breathing as I say it to remind myself to breathe, but that when we're on this path of healing and, like, really becoming whole, like, you know, mind, body, spirit, that we don't want to be cut off from any part of our body, especially this part of our body. So really be able to sit with, like, every part of ourselves, and to be able to voice it, or to talk about the pain we might be feeling, and to find these outlets to get the kind of healing and support so that we can be whole. Because it's like, if we're cutting off certain parts of ourselves, it's very hard for our bodies to work, you know, harmoniously and with an equilibrium that we would want to have regular cycles, and to, you know, so. And again, it's sad. I think so much of it does come back to the shame that we feel in the culture. And thank God conversations like this are happening, and there's more and more resources like what your clinic's providing. But I think I'm just grateful to have you on here to voice it, because it's sadly it's like a very, very prevalent issue.
It is, and it baffles me. I feel like every week I'm having a new conversation with someone who just feels like it's normal, or it's normal to not talk about your pelvic floor at all. And to me, it's a shame, because it's such a powerful part of our body too. Like watching births and being a part of some of people's most important moments, you can see the power of the pelvic floor, and something that can do something as incredible as bring a human into the world. And even if that is through C-section, there's still pelvic floor involvement there too. That needs attention. The pelvic floor does something really powerful, and it probably needs to be tapped into after that. And yeah, there's really big things that can happen after birth, like prolapse, and that is something that pelvic floor can really help retrain those muscles as well. And there are just little things as well, of like how to enjoy sex again after having birth, and when you're ready for that. And yeah, there's a lot there.
Yeah, thank you. I don't know if we sometimes get questions today. It doesn't seem like we have questions. I feel like maybe a lot of people are just like taking this information in. If someone is listening to this and is feeling like, wow, that's me, or I know I suffer from endometriosis, or, I had a really tough birth and I've never really felt quite the same after, or, I've always had painful sex, or whatever it is, what do you suggest generally speaking, what do you suggest they do in terms of sharing this with their doctor, or trying to find the right kinds of resources in their area to get the kind of support that's going to help their bodies heal?
That's a great question. So the first thing, as far as talking to your doctors, is I always write out a list of questions. And I personally am with a healthcare provider that it's really hard to get FaceTime with my doctor, just the way that the system works. And so I always go in with a list of questions, and I go in with a goal of what do I want the outcome of this appointment to be. And I always ask the question, whatever they bring up, I always ask the question, what are the benefits of it? What is the potential harm? And are there any other alternatives to it? So everything that they offer, and I'm pretty sure my doctor was so annoyed with me when she was trying to help me get an IUD that I love now, but I was just asking so many questions, like, okay, what could go wrong? What's the worst case scenario here? Not that it'll necessarily happen, but I want to be aware. What's the best case scenario? What are the benefits of this? And do we have any other options? Or is my option just no action? Like, what else can we do here? So I'd really go in with your goal. So if you had a traumatic birth and your goal is to get back to having sex that isn't traumatic or painful for you, then go in with that goal and explain to them specifically why that is important to you. And hopefully they'll provide other options for you. And maybe that's pelvic floor physical therapy. Maybe that is therapy. Maybe it's a combination. Hopefully it is a combination. I think we all need that. And really help them get you to that goal. Because if they don't know a goal, they're not going to know where to point you. And they're going to look and say, physically, you look fine, or whatever it is, and go from there. So yeah, really going in with your goal and a list of questions would be helpful. And then as far as finding people who are specialists in your area, I would just do a lot of research on Yelp. That's what I did, and I reached out to a lot of people. And most clinics will have either an initial evaluation or a complimentary session where you can talk to the physical therapist before you do any care. And it's okay to say no if you don't feel comfortable with them. It's a very intimate thing. In my experience, most pelvic floor physical therapists are really incredible, and they understand how intimate of work that they do. But, it's kind of like dating. You got to find someone who you're comfortable with so that you can make that progress.
Yeah. That's so important, I think, especially for a pelvic floor therapist, but any therapist or any doctor, is to really check in with yourself and ask yourself, does this feel like a fit? Does it feel right to me? Do I feel safe? Do I feel like I can advocate for myself in this relationship? Because it is a relationship. And we often give our power away to doctors because we're taught that, and granted, like, they're incredibly trained and wise, and but we don't but I always just advocate that people really check in with their instincts. If something feels off, it's not the right fit for you. I had an OBGYN once when I was in my early 20s, and I mean, I've gone to lots of OBGYNs over the years, and I'll never forget, like, there was something that absolutely felt wrong to me. The exam was really painful. It was strange. I mean, I just remember, and I was so young that I was like, maybe this is the way it's supposed to be. And it's like, but there was something deeper in me that knew that that wasn't true. And so I just think it's so important that we check in. We have a couple questions, one from Leslie and one from Jennifer. So I'll just read them. And then if you have any thoughts, Renae. The first is from Leslie. She said, can you speak about urinary leakage? So many women feel like it's just a part of getting older.
Yeah, absolutely. Where I live in Glendora, we have a much older general population, and a lot of women do think that it's just normal, a normal part about getting older, and it's not. Urinary leakage and incontinence is really something that is all about pelvic floor strength. And that is one of the main things that our pelvic floor physical therapists work with. And a lot of women see this after they've had kids. And the story that I've heard over and over again is, well, I had 3 kids, and then I had 3 kids to take care of, and I didn't really have time to take care of myself for 15 years. And then 15 years later, I was still dealing with it, and it was just kind of a part of life at that point. And now I don't feel like I can run anymore because I'm embarrassed, or that's really hard. And the fact is, no matter how far beyond the onset you are, there is a chance to change that. And just like any muscle, it's just been inactive and it needs to be trained again for that.
That's great to hear. Yeah, so it's a muscle, so it's still there. It can be worked and trained.
Still there, and it's solvable. And I think people don't know that it is solvable.
Yeah, cool, great. Jennifer James is writing, what advice or steps would you advise dealing with endometriosis about to go through the IVF process?
Man, that is a really big question. I personally have never been through that process. I would start with have a lot of grace with yourself. You already deal with a chronic disease, and I know what that's like. And it can be a lot on its own, and you're about to embark on something that's really emotional and beautiful and also hard. And so you're adding that with your chronic disease. So I would just say have a lot of grace with yourself. I don't have any medical or technical information or advice for you. But just like anything, it's a process to learn how to go through. And there are a lot of people who are in that boat with you, I would say. And there's probably a lot of support groups. So I personally have found a lot of really good support groups on Facebook. So I'd also look into that.
Yeah, I mean, I guess one question, just technically speaking, like, are there other things that you've done, like dietarily or exercise-wise or with the PT that has helped you kind of keep your endometriosis at bay, possibly?
Yeah, that's a great question, and I forgot to touch on that earlier. Nutrition is kind of a big question for me because from the onset of my symptoms to now, my nutrition has changed completely. But as a starter, I would say, especially if you are trying to conceive, to kind of slowly weed out anything that is inflammatory. And that includes things that are carbs. A lot of oils, cooking oils can be really inflammatory, vegetable oil being the biggest offender there. So if you try and weed that out of what you're cooking and what you're eating, that can just go so far. And if you have endometriosis, you know the experience with endobelly, and hopefully you'll be able to see the difference in your inflammation from cycle to cycle and know that it's working. That's the biggest indicator for me that my diet is going well, is how big my endobelly is that cycle. So yeah, really the basics would be, of course, cutting out alcohol, really trying to lower carbs and eat a lot of vegetables, and stay away from toxic oils, vegetable oil being one of the biggest ones that is used.
Yeah, thank you for that. That's helpful. Yeah, also, I just want to throw out there too, I mean, I'm not an expert on endo, but I know that like Mayan abdominal massage is something that's been really important. It's like at the CNY Healing Arts Centers, there's many different practitioners who practice Mayan abdominal massage. You might want to look at also other levels of like toxicities in the body and doing detoxing and things like that. Jennifer Waters, who works with the Fertile Spirit, she's a functional medicine protocol for people to kind of detox and kind of get their hormones as in check as possible. So there's a lot of, different approaches, I think, as well as the pelvic floor therapy. I guess we'll just take one last question. It's about, would you recommend starting pelvic floor PT prior to IVF or new pregnancy for someone who has pressure incontinence? Can you continue throughout pregnancy with pelvic floor PT?
Yes and yes, absolutely. Again, for any woman, especially if you know you have an issue, start as soon as possible. You will get so many cool tools to use throughout your pregnancy journey. And I highly recommend finding a pelvic floor physical therapist that you love before you're in it, working with them throughout your pregnancy, because pregnancy can be uncomfortable and they can provide so many cool tools and resources and work with you and your other care providers to really create a really cool birth experience that you feel like you have more control of. And then they can work with you postpartum as well. So it really creates a good continuation of care for you. So absolutely, please go find a pelvic floor physical therapist.
Awesome. Okay. Yeah. Well, Renae, thank you so much for bringing this to light. I think all of this is about bringing these things that we've kept in the shadows for so long in our culture to light and sharing this information and these resources, because a lot of us do not have to struggle or be in pain or deal with chronic pain in the way that we might think we do, and to really get clear with your doctors, to really advocate, to really trust your instincts. And to continue to seek answers, because so many times they are out there. So,
yeah, absolutely. It's been an honor to be talking about this and just increasing the knowledge for women in this stage of life.
Okay, take care, everybody. See you soon. I'll be back next Thursday with Amanda Ehrman, who's another fertile spirit coach, and she's a clinical hypnotherapist. So we'll be talking about that and other ways of healing. She's awesome too. So see you soon. Bye.